Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, blood clots, as you know, are gel-like clumps of blood that are beneficial. They're beneficial when they're in response to an injury or a cut or a laceration. They plug up the injured blood vessel and they stop the bleeding. But, you know, some blood clots form inside your veins without a good reason, and they don't dissolve naturally. And these can require medical attention, especially if they're in the legs or are in a more critical location like the lungs or the brain.
Blood clots can sometimes form in the legs during air travel because passengers are immobile for long periods of time, often sitting in cramped spaces with little leg room. Oh, if only could be in first class all the time.
I know, I'm back there with you in the economy. Yep.
Yeah, sometimes it is referred to as economy class syndrome. The clinical term for this type of blood clot is deep vein thrombosis. And here to discuss is the director of the Travel and Tropical Medicine at Mayo Clinic, Dr. Rizwan Sohail. Welcome back to the program, Dr. Sohail. It's good to see you again.
Thank you. It's good to be back.
Thanks for being here, Dr. Sohail. So a lot of us are set up for a DVT or a deep vein thrombosis when we travel. Tell us first what it is how it happens.
Well, sometimes due to prolonged immobility, we form blood clots in the deep veins of the legs. And if diagnosed or untreated, they can break off and then go into the lungs, where they can block circulation in parts of the lung. And that is what we're really concerned about, not really just the clot in the legs, but traveling into the lungs and causing chest pain and shortness of breath.
And it can kill you, right?
Yes, it can definitely be life-threatening.
Why is it that this happens more when you're traveling, or does it?
Well, travel, especially the air travel, makes us sit at one place for a prolonged duration of time. And it's really the immobility, which is the risk factor for deep vein thrombosis. Plus, people are exhausted when they travel. They get dehydrated. They don't move around that much. They feel they're cramped into their economy class seats. And so that's why air travel puts you at high risk. Plus, there are some data suggesting that due to the low air pressure during cabin travel and low oxygen level makes your blood more thicker and more likely to clot.
Are there some people who are more at risk than others?
Yeah, there are a number of defined risk factors for deep vein thrombosis. These include age more than 50, women who may be pregnant or using oral contraceptives.
Yeah, now tell us why that is, because that's an interesting phenomenon.
Yeah, so oral contraceptives or hormone replacement therapy or certain chemotherapy drugs make the blood more viscous and thicker. And that's more likely to clot. Similarly, patients who have history of heart failure or those who have a major recent surgery or cancers are also at high risk of blood clots.
And pregnant women.
And pregnant women, especially during pregnancy or even after 6 to 8 weeks after delivery as well, they continue to be at high risk.
And isn't that partly because of the fetus, when it gets that large, it actually puts pressure on the large vein near the fetus so that it makes it difficult for the blood to return from the legs?
Absolutely. So pregnancy itself, due to hormonal changes, makes the blood more thicker and at risk of clotting. Plus, in addition, immobility and poor circulation in the legs, as you mentioned, due to the presence of fetus, makes pregnant women at high risk of blood clots as well.
And what about obesity?
Obesity is also a well-known risk factor. So if, and I think it's also mostly related to immobility as well. Plus obesity itself is a metabolic syndrome. It makes blood more likely to clot as well.
Who did we miss in the high-risk group?
Pretty much everybody.
Cancer patients?
Cancer patients, major surgery, history of venous insufficiency, those who've had fractures that are unlikely to move.
No, venous insufficiency. So if I have varicose veins, does that put me at increased risk?
Not just the superficial veins, but if the deep veins are incompetent, then definitely you would be at high risk for blood clots.
Why do cancer patients have trouble with this?
So cancer itself produces certain changes in the blood clotting mechanisms, makes blood more likely to clot.
What about height? Does that have anything to do with it?
So
Shorter people versus taller people?
So there was an interesting study from World Health Organization where they reported that patients or travelers who are taller than 6'3" are at high risk of blood clots, and we think it's because they have less leg room, they are more cramped in the economy class, and therefore more likely to form blood clots. Interestingly, travelers who are shorter than 5'3" were also at high risk. And the theory behind that is that their legs may not reach the ground. So the edges of the seat may be putting undue pressure on the veins on the back of their knees, making the blood flow slow and more likely to clot.
Is a patient, or rather is a traveler, more likely to experience deep vein thrombosis on a long flight or a short flight, or does it make any difference?
The duration of flight definitely makes a difference. In general, the flights that are longer than 4 to 5 hours double the risk of blood clots. And the flights that are longer than 10 hours almost triple or quadruple the risk of blood clot formation.
All right, so don't go too far.
Yeah. Okay.
All right, let's talk about
home.
prevention. How do we prevent getting a blood clot?
Well, there are a number of things people can do during the air travel and before that. So during the travel, if you get to sit at the aisle seat, then obviously it's easier to move around. And keep yourself hydrated. Don't drink excessive amount of caffeine that leads to dehydration, or alcohol use, because it's both dehydration and then it makes you sleepy, so you're unlikely to move. Stretch your legs, even if you're sitting, lift your heels, rotate your heels so there's more blood flow.
And that helps return the blood back to the heart, which would help prevent the clots, huh?
Exactly.
Muscular action of whatever kind. So even if you're stuck in the middle seat, move your ankles, move your legs as much as you can.
Absolutely.
What about taking an aspirin? I mean, a lot of people are taking aspirin to prevent a clot in their coronary arteries, their heart arteries. Would it make sense to take an aspirin before you fly?
So one would think so, but at least the studies that we have suggest that the aspirin does not really alter the risk of blood clot during air travel that much. The things that can be helpful before you travel is that if you're in one of those high-risk categories that we talked about, you can go talk to your doctor. They may give you prescription for compressive stockings. So below-knee compressive stockings are helpful. If you're already on blood thinner due to some high-risk factors, then check your blood test to make sure that your blood is thin enough, just the way your physician wants. Or if the patients are really high risk and they're not on blood thinner, then the doctor may prescribe an injection of a medicine called heparin that you give under the skin a couple of hours before you travel, and then maybe the day after travel.
All right, so the keys are to move if you can, particularly if you're in an aisle seat. If you're stuck in the middle, just kind of move your legs and ankles around as much as you can. Hydrate and avoid alcohol and caffeine.
Exactly.
All right, we've been talking to Dr. Rizwan Sohail about how to prevent blood clots when you're traveling. Thanks so much for being with us.
Thank you. It's a pleasure to be here.